Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys, and to our special advisory committee that can be found at www.scbrtalk.com/advisory committee. Click on the link and learn about the remarkable leaders doing the work. Okay, everybody, speaking of leaders and on this grand election date, I have the distinct privilege to introduce to you Lizette Escobedo. She is a passionate advocate for civic engagement and social justice with over 2 decades of experience leading impactful initiatives to empower Latino communities. Currently serving as Vice President of Government Relations and Civic Engagement at AltaMed Health Services, Lizette has spearheaded successful campaigns to increase voter participation and access to healthcare. She played a key role in the Ándale, ¿Qué esperas? COVID-19 vaccine outreach program, resulting in over 130,000 vaccinations, and led the My Vote, My Health campaign, reaching over 500,000 Latino voters. Lizette's commitment to social justice extends beyond her work at AltaMed. She has held leadership positions at several prominent organizations, including the National Association of Latino Elected and Appointed Officials, NALEO, Educational Fund, where she directed national efforts to ensure a full count of Latinos in the 2010 and 2020 censuses. She also helped launch the Ya es Hora, Ciudadanía, and New Americans campaigns, assisting thousands of legal permanent residents in their path to citizenship. Throughout her career, Lizette has been a driving force behind numerous social justice and civic engagement campaigns. She played a crucial role in the Alliance for Citizenship, one of the largest nationally coordinated immigration reform coalitions, and helped raise over $1.4 million for the Mi Familia Vota Education Fund, supporting voter registration and mobilization efforts in Arizona, California, Colorado, Nevada, and Texas. Lizette's dedication to her community is evident in her run for Whittier City Council in 2018 and her recognition as Woman of the Year by California Assembly Majority Leader Ian Calderon in 2019. She continues to serve on the boards of Make the Road States and the National Civic Health Alliance and Southeast LA CELA collaborative, further demonstrating her commitment to creating a more just and equitable society. Escobedo was born and raised in Southeast Los Angeles, known as a civic desert community with the highest COVID death rates and historically undercounted in the census. As the daughter of Mexican immigrant parents, she aspired to be the voice of her community and people like her parents who were often ignored, voiceless, and disenfranchised. Lizette graduated from the University of California, San Diego, and is the proud mommy of her 15-year-old Rosa and 18-month-old Nicolas, who are her pride and joy and reason to make this country, society, and world a better place. Lizette, thank you so much for being with us today.
Thank you so much for having me. It's an honor and pleasure, especially on Election Day.
Absolutely. And, as I mentioned, when we were reading our bios, we have so many overlapping, interesting things that we share. But let's start with what personal experiences. You were born of 2 Mexican immigrant parents. So talk about the experiences in your upbringing in Southeast Los Angeles that have influenced your passion for civic engagement and social justice.
Well, for me, it was, my parents. My parents were my inspiration. My dad came from Mexico with a 2nd grade education. My mom was actually an accountant in Mexico, but came here and realized that it was tough without, a valid work permit and all the things. My dad had to do manual labor because he only had a 2nd grade education. So I used to actually read and write for him both in English and Spanish. And in his manual work a lot, he worked with die casting quite a bit, which is kind of melted metal. They do plain parts and the whole bit. And he used to have these scars all over his arms and on his face because melted metal would jump on his skin and then it would just kind of seep into that. And I always wondered, where was that from? Why did he have all that, right? Why didn't he go to the doctor to get it taken care of? And he would always tell us, I did this so that you guys don't have to. Mm-hmm. And so when the question of college and what you're going to do with your life came around, it wasn't, what college are you going to? It wasn't, are you going to college? It was, which college are you going to? And making sure that those sacrifices were worth it. So I knew I had to do something for them and for the community because they worked so hard for me. We lived in I have 4 brothers. We lived in a 2-bedroom, 7 of us in Southeast LA in the city of Bell Gardens. And my parents just never told us this is your limit. They always said, we are here, but you can be more. You can do more, but never forget where you came from. Never forget that your first language was Spanish. Never forget how hard we fought to make sure that you guys had food at the table, right? And so we really took that to heart. I took that to heart, and I'm sure you know that when you're a daughter or a son of immigrants, you become the attorney, you become the translator, the interpreter, you become the representative at like 10 years old, right? And so I had to help them navigate a lot of county services. I had to help them navigate a lot of application process for healthcare or for an electricity bill, whatever it may be. And so I just realized that the system was not built to work for people like my parents. And so I thought I can either I can either just try to work within the system and try to figure out how they can navigate, be their interpreter forever, or try to disrupt the system in a positive way that makes it so the system and the institutions that they were built on work for people like my parents and that they feel like they have a voice. And so I've been committed since, 25 years ago. I want to give back to the community like my parents and the community that also doesn't have a voice, right? The 11 million. So that's what started everything, right? This little brown girl from Southeast LA who just thought that she could. And here I am.
And I absolutely love it that your parents said, this is just the beginning. There's so much more ahead of for you. And the fact that you were everything to them from such a young age, I'm sure had a major influence in your advocacy work for immigrant rights and citizenship. Talk about some of that advocacy work.
Sure. So one of the interesting pieces that I saw in the conversation around immigration was the lack of understanding of how the immigration process works. Right? Because there's this constant idea that somehow immigrants don't come in the right way, or somehow that there is why don't you just do it legally? That there's this path to citizenship that is months away. It doesn't work that way. And so one of the things that I wanted to dive into is, how do I help the immigrant community? How do I understand the process better? And so there is actually a very long process for immigrants who come to this country to work hard. First, you have to become a legal permanent resident, which is an uphill battle. There's almost like no pathways to get there. And then after that, they have to meet certain requirements. They have to take a civics test. They have to get a background check. And then they can apply for citizenship. And then they have to go to an interview. And then the interviewee at the U.S. Citizenship and Immigration Services has to determine that they have, expressed everything in good faith and then sign off. And then that's how you become a citizen. And this is I'm talking 20 years, right? And so what I wanted to do is, one, make sure that I was educating the public on the fact that there is a process and it's almost impossible to get through. And two, that we have, at that time, we had 8.9 million legal permanent residents in this country ready to apply for citizenship, but hadn't done it because of fees, because they didn't understand the process or didn't see the benefit. And then I wanted to reach those over 8 million legal permanent residents to make sure that they could use the power of their future vote in this country, because they are part of it. Some of these folks have been legal permanent residents for over 20 years. And so I decided to, and I actually learned the process because my mom applied for citizenship in 1991 when it was $91 to apply for citizenship. I would go with her to night school to read through the exam, and she would study, and it was such a moment of pride for her to become a citizen. And my mom became a voter, a frequent voter, ever since 1991. My mom has never missed an election. And so I wanted to help others in that process. I wanted others to be fully incorporated into the American democratic process. And so we engaged in this campaign, Yes Hora Ciudadanía, right before the fee hike. There was a huge fee hike that went from like 100 and something to 600. And it was an urgency. Yes, hora. It's time, right? You need to do it because the fee's going to go up. And so we were able to get 1 million Latino legal permanent residents on the process to become U.S. citizens. And that was when we had one of the highest Latino voter turnouts in history in the 2018. Not in the 2018, sorry, it was before that, 2008, in the 2008 election. And so, you know, it all just came from my parents being the most American people that I know, despite them being immigrants, and how difficult the process was for them. And, you know, and they said 1 million, that's pretty crazy. It's not going to happen. You're not going to do it. And, you know, my parents never told me I couldn't. So we went in and we did it.
You did it. Absolutely. I love that. So, Lizette, how do you effectively mobilize communities to participate? Voter registration and turnout initiatives, especially among, obviously, the Latino population, particularly in this 1 million new Latinos starting their pathway into citizenship?
So it's really important to understand that Latinos are not a monolith, right? We hear it constantly, but like, what does that mean, right? It means that we are just so different amongst us. Right. And so it's really important to have the cultural competency to know how to reach the community. One of the big pieces is meeting the community where they are at. And it doesn't just mean physically, it also means in society, in the world. Right. So, for example, when the U.S. citizenship application process was $675, that is a lot. Right. That is a lot for, you know, Josefina, who might be struggling and only gets her Social Security check. And, you know, is she going to use her entire Social Security check to pay for the application process? Or is she going to eat it to feed herself and her household? And so it's really important to understand those dynamics and understand that you have to figure out how you lower the bar of entry for Latinos who usually don't have access to these type of things. So when I was at NALEO, we started the American Dream Fund that we called, where it was actually a grant program for folks who couldn't afford the citizenship process. We worked with credit unions. I did a whole lot of fundraising for that. And so that's the same concept for voter registration, for voter engagement, for census enumeration. It's understanding where they're at and how do we meet them there. The other component is, I always tell folks that Latinos will only come to a party if you invite us, right? Mm-hmm. And so when you are not investing in outreach to our communities, if you are not investing in year-round programs to make sure that folks are understanding what cultural civic participation looks like, if you're only investing in folks who are participating at higher rates, which usually tend to be higher income, who tend to not look like us, right? Then don't be amazed when they're not showing up to the party, right? Meaning when they're not participating in higher rates in elections and they're not getting enumerated in the census. So part of this work is, yes, doing the outreach, understanding where they're coming from culturally, understanding that we're not all the same. Mexicans are very different from Cubans. Cubans are different from Puerto Ricans. First generation is different than second generation. It's understanding those pieces, but also pressuring the institutions that the voting institutions, census institutions, to invest more in Latinos so that we have a fair shot.
Talk about why it's important to AltaMed to get its patients and the surrounding communities civically engaged.
So at AltaMed, one of the big components of providing adequate healthcare for our communities is understanding that we can only tackle 20% of our patients' health when they come into our clinics. What does that mean? That means that if someone has asthma, we can make sure that they get the medicine and that we're constantly monitoring them. That means if someone has diabetes, we get them the affordable medicine and monitoring them, right? But that doesn't tackle the chronic conditions that created those illnesses, right? That's 80%. That's what we call social determinants of health. That is determined by the environment they go back into, by access to higher education, access to jobs, access to housing, transportation, right? And so when we tell, a patient, you need to walk 30 minutes every day to make sure that we get your diabetes under control or your weight or whatnot, that's great. But what if they live in a community where you can't walk after 8 p.m. because their public safety is an issue, because there's no parks, right? And so then those communities will consistently be ill, till the end of time. And so one of the things that we wanted to do is create the conditions that will make them healthy. And we can only do that when we have leaders and policymakers that are pushing policies that will address those issues long term, right? I can continue to provide medicine for your asthma, or I can pass a policy that says that no freeways will be placed within a certain mile radius of your neighborhood to make sure that the asthma rates decrease. And so we are going straight to the institutions that build the power, that elect the leaders and that make the policies in order for us to address these chronic conditions long term. And we feel that it is our duty, if we ever want to tackle that 80% of the social determinants of health.
Please share the connection between healthcare and voting. By the way, I love your earrings because today is election day, and I can't wait to hear, because it's a very important thing, right? We were talking about this, and when we talk about if you're not at the table, you're on the menu. So this is where that comes into play, and how that connection interacts.
Yeah, absolutely. So an important, and I alluded to this a little bit earlier, an important piece of the outreach that happens every election cycle, right, has to do with folks who vote frequently, right? If you vote frequently, if I'm a candidate or I'm a campaign, I'm going to continue to contact you because it's probably really cheap to get you to turn out. And so it's probably going to cost me 2 phone calls to get you to turn out, right? Because you're a frequent voter. Frequent voters tend to be higher income, tend to be healthy, tend to be, affluent, higher education, et cetera. And so those are the folks that are consistently being invited to the table, right? And those are the folks that are making the decisions at the tables. They are making decisions for us and about us without us, right? And it's because our communities are usually not voting at higher rates, right? And we also tend to be lower income. We tend to have chronic health issues. We tend to not have access to higher education, but because we're not voting consistently, there is no outreach that's happening in our communities. There is no consistent investment by campaigns or elected officials at times, or organizations in our communities. And so you just create this culture that continues to make us sick because we're not building the power. The folks in power are not listening to us because there's not going to be any consequences, right? If I don't get you that green space, or if I don't get you more funding for that healthcare program, and you're not consistently voting, I know I'm not going to face any issues next election because those folks are not going to be at the table. So I can continue to make policies for you and about you, and know that you will not be at the table the next time around. And so creating a culture of civic participation is really creating a culture of health, right? Because we can't make our communities healthy long-term if we are not building the power that creates the conditions to address the health disparities. And so there is both a direct and indirect link between voting and healthcare, but there is a long-term link, which is the most important.
Please talk about education, right? Because education and awareness, that's what it's about. And getting all of these important issues in front of the community and investing, like you said. What are initiatives that are important to AltaMed? We can go into protecting access to care, improving Medi-Cal reimbursement, workforce development funding, et cetera.
Yeah, so all of the above, right, are important to us. But the top issue for us, specifically this election, is Proposition 35, where we want to increase funding for Medi-Cal in a very particular way. So there's something called the managed care organization tax, where managed care health plans and managed care organizations get taxed a certain amount, and it goes to the state for a specific fund that is supposed to fund Medi-Cal programs, right? For the past couple of years, at times it hasn't gone to that because the state has had a deficit. There's other programs, right? Other things that need to get funded. And so because of that, one of the areas where we're really struggling is the fact that the reimbursement rates for Medi-Cal patients are very, very low. What does that mean? That means that if I'm a healthcare organization and I want to help a patient that is on Medi-Cal, what the state is going to reimburse me to see that patient is way lower than if I take someone with private insurance, right? And so if you don't increase the reimbursement rates, then by default, you're creating disparities between access for some and, access for some and no access for others, right? And so we want to make sure through this process that, one, we get that managed care organization tax back into Medi-Cal funding. And how do we do that? By increasing reimbursement rates for Medi-Cal recipients. And by doing that, it's going to do a couple of things. It's going to increase access to primary care providers. It's going to increase access to specialty care providers, which is a huge issue, especially amongst community health centers. And by way of that, we can actually take on the folks who now have Medi-Cal that didn't before because of the expansion of Medi-Cal. We got healthcare for all. We got expanded Medi-Cal across the state of California, but unfortunately, we don't have the funds to be able to take on that expanded Medi-Cal, and it becomes a system of endemic disparity by reimbursing providers that are willing to take Medi-Cal patients a lot less than providers that take private insurance. So this is the proposition doesn't just provide funding for that, but it provides a sense of parity for folks who are doing the work of assisting folks that are on Medi-Cal. So that is important for us, along with workforce. So there's a couple of things around healthcare workforce. One, we all know we need more folks in the healthcare field, right? Period. We need more nurses. We need more doctors. There's not enough across the board. A big issue for us is the prime mission of AltaMed is to provide quality services in a culturally concordant manner, in a language that our community speaks, in a culture that our community understands. That becomes very difficult when only 6% of all physicians in the state of California are Latino. And Latinos are 39% of the entire state of California. And so we want to make sure that there is investment in a healthcare workforce pipeline, but a healthcare workforce pipeline that focuses on communities of color and investing in them from high school to medical school and through residency programs. And so this is a huge issue. And I'll be honest, a newer issue for me when I came into AltaMed, right? Because I came from a different space, right? Civic engagement, social justice. But as we were talking about it, I thought, why aren't we all fighting about this? This is actually a big issue, right? We have places that have language deserts where our communities are speaking another language or speaking Spanish, and there's actually no providers that speak that language. And so the investment is key. That is going to be a huge issue for it. It has been, and it will continue to be on the advocacy front. But there needs to be something that happens in our, not just in our healthcare system, but in our education system that creates a consistent pipeline and that invests comprehensively in a pipeline program.
Absolutely. And with that said, Lizette, thank you so much. We are going to hit a break. Everybody, Yvette Walker with ABC News and Talks. Southern California Business Report, speaking with Lizette Escobedo, a dedicated advocate for civic engagement and social justice at AltaMed Health Services, California's largest federally qualified health center with over 20 years of experience. Lizette has championed initiatives that empower Latino communities, including the transformative My Vote, My Health campaign, which has engaged over 500,000 Latino voters. This nonpartisan initiative at AltaMed encourages patients to recognize the power of their vote in influencing health policy by bridging healthcare and civic participation. Lizette's work aims to uplift underserved communities and address health disparities, fostering healthier and more informed communities. When we return.
Hi, I'm Dana Rademacher with MGR Property Management.
A lot of people wonder about the value that property management has for their property. Property management can include all property types, including residential, commercial, and HOA. It is valuable because property managers are experienced in what can happen at your property. We're aware of liabilities. We're able to do predictive and preventative maintenance. We know what is coming up with the changes in the weather, the seasons, how old certain aspects or different capital projects at your property are. We're able to best negotiate contract pricing, legalities with your tenants, and anything else that you may need to ensure that you're getting the full value of your property.
If you're interested in speaking with the representative at MGR Property Management regarding your property management needs, you can visit our website at mgrrealestate.com, or you can call our number at area code 909-581-6600 to be connected with a representative.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
Ontario International Airport is onto a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
We are the Empire Strikers, the professional sports team of the Inland Empire. We are a fast-actioned and community-inspired pro indoor soccer team. Our mission is to inspire the Empire. Home games, community events, watch parties, and youth camps are all back. Professional indoor soccer is back. Join us and come watch the greatest show on turf at Toyota Arena or on Twitch. Visit www.theempirestrikers.com for more and any information.
Cal State San Bernardino is home to the only School of Entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Welcome back, everyone. Yvette Walker with ABC News and Talk, Southern California Business Report, speaking with Lizette Escobedo, a dedicated advocate for civic engagement and social justice at AltaMed Health Services, California's largest federally qualified health center. With over 20 years of experience, Lizette has championed initiatives that empower Latino communities, including the transformative My Vote, My Health campaign, which has engaged over 500,000 Latino voters. This nonpartisan initiative at AltaMed encourages patients to recognize the power of their vote in influencing health policy by bridging healthcare and civic participation. Lizette's work aims to uplift underserved communities and address health disparities, fostering healthier and more informed communities. Thank you so much for being with us today, Lizette.
Thank you for having me on such a special day. See, election day.
Yes, election day of all days. Perfect. So prior to the break, you went into AltaMed's priorities of, access to care, improving Medi-Cal reimbursement, and what are some of those priorities? And you mentioned Prop 35 and workforce development. Those are huge issues, and the importance of having that cultural sensitivity and attunement to the community. When 6% of physicians are serving 39% of a population, there's a big disparity there, right? And a large need. So talk about the ways that you are developing that workforce development pipeline to bridge that gap.
Yeah, so we actually have a family medicine residency program within AltaMed, and we have an over 80% retention rate, which means that folks who are doing their residency with us, I believe in the last cohort out of 6, 5 stayed to work at AltaMed. And so that the residency program is huge for us. We also have an actual medical education program that has various pipeline programs that they invest in. We also work very closely with the UC system. There's a UC Prime program that earmarks certain slots, right, for medical students. We have partnerships with the University of Laverne, where we're actually looking to partner on a nursing collaborative, because there is also, we talk about doctors, but there's also actually a very huge gap amongst nurses in the nursing field. And so we're building those partnerships with higher education, but we're also starting to build partnerships with high schools and middle schools, and making sure that STEM programs and that the idea of becoming a doctor is actually something that our students and our kids and our communities can envision. Most of the doctors, we have 400 physicians, come from the communities that we serve. If you talk to some of our doctors at AltaMed, they will tell you about the story of them growing up in Southgate and Huntington Park in East LA, and they come back to serve, right? But again, one of the big issues is that you have to understand the mission of a federally qualified health center, and especially a federally qualified health center like AltaMed, to want to stay and do the good work, right? Because, again, with the medical reimbursement rates, it becomes a challenge of retention, right? Retaining those doctors and making sure that we keep them empowered. And so the really neat part about our work is that the doctors who join us also get involved in civic engagement work. They knock on doors with us. We have our White Coats for Change program. And so a lot of the folks that we manage to retain stay because, come because they want to do good, and stay because of the mission and because of the long-term impact that they're going to have. But again, the investment in these pipeline programs has been challenging at the state and federal level. We also have an Institute for Health Equity within our organization, where we look at these pipeline programs. We have various research that we do. What are some of the gaps in terms of pipeline programs? And so when you think about AltaMed, we look at every aspect of providing quality and culturally competent care. But the fact is that we need more of, and we need more funding for.
Right. And my understanding, as you talk about the workforce pipeline, is that California has the lowest rate of reimbursement for Medi-Cal patients. Paired with that the tax that is being housed by Sacramento is being dispersed for other non-Medicaid costs, right? So they're supplementing other areas, which I can't imagine a more important area than our health, right? But that's why, again, Prop 35 is on the ballot. Do you believe if Prop 35 passes, it will assist with more engagement in terms of having those physicians that can be reassured that the reimbursement rate may be higher, but that those funds will be dedicated and reserved specifically for their patients?
Absolutely. And another, byproduct if this passes is the fact that we would have access to more specialty care providers. Because right now that is the biggest challenge, right? So for example, when we refer someone out to a specialist like a dermatologist, there is, I think in one of the regions that we serve, there's like one dermatologist that will take the Medi-Cal reimbursement. And so you may need a a specialty care provider immediately because you have an issue, but your wait time might be 5 months, 6 months, right? Because there's very few specialty providers that will take on that reimbursement rate. And so you'll expand access to specialty, you'll expand access to more primary care providers. And one of the things that the proposition will do is also write into law the fact that these funds must be used for Medi-Cal funding. And so, like you mentioned in the past, these have gone to general funds, right? And it doesn't always mean that it goes towards things that aren't important. Sometimes they are. But at the same time, if we are expanding access to folks, which is the right thing to do in the state of California, we have to expand that funding, and we have to make sure that we are reimbursing in a way that achieves equity and that doesn't that doesn't leave behind those folks who can't afford some of these services, and especially with specialty care. That is a big one.
Absolutely. What potential impacts could the permanent extension of this tax have on healthcare access and the quality for Medi-Cal beneficiaries, particularly in underserved communities within California, assuming that it does pass? You did mention that it can expand access to specialty services. Workforce development pipelines can expand as well. In addition to that, I wanted to ask you, what projections do you have in terms of expectations or numbers of physicians, nurses that you are hoping to see within the first year, cohort, 2 or 3 years of this new effort or these newer efforts with surrounding higher education entities, and paired with the potential passing of Prop 35?
Yeah, so we haven't done the deep analysis yet, right? But we definitely know that it will increase access. That is a given. And by way of increasing access, it allows us to have that quality of care, right? Because we increase access to primary care providers, specialty care providers. In addition to that, within Prop 35, right? One thing is a reimbursement rate, but within Prop 35, it also provides funding for things like community health workers, for things like pipeline programs. So there are some additional benefits. It's not just the reimbursement rates, right, that come for the community. And so when we look at, for example, providing of whole person care, right? There might be an interaction where a community health worker will be extremely beneficial and extremely helpful. Then you may go on to a nurse, and the nurse may help you with certain things. And then by the time you get to see your primary care doctor, he is focusing on the root of the problem or the thing that he can tackle. But we need funding for that full journey of the patient, right? And so some of the funding for Prop 35 provides funding for that full journey that can assure folks quality of care and whole person care. And so we're hopeful that this proposition will pass, that the voters will understand the benefit of increasing access, increasing funding, and again, increasing funding not just for Medi-Cal, but also pipeline and community health workers, and that will start seeing more primary care providers. We need over 4,000 primary care providers in the state of California by 2025 to meet the need. And so, having an increased reimbursement rate will help us with that. And then again, same thing with specialty care. It's very difficult when we send someone out as a referral to get their specialty care, and then we need to bring them back to see them for their primary and manage their entire care, because that's part of quality, whole person. But when that specialty care has a wait time, right, 5 months, 6 months, it's very difficult to stay on track with their treatment and with their care, with their health. And so it's a domino effect, but we are hopeful. There's no paid opposition for Prop 35, so we are hopeful that the California voters will do the right thing.
So tell us how this tax actually works. Is this a tax on the voters? Is this a tax on who?
So this is a tax on healthcare plans, on managed care organizations. So it's known as the MCO tax. And so we actually will not be paying a tax not the voters. And so that's where it can get confusing. So no more no additional taxes for us. It's something that they already pay that is actually mandated by the city of California. There is a fund that it goes into, right? So this is happening now, and there are funds there that go in there. And all we're saying with the proposition is that we are putting into law that these funds are to be invested back for their original intent, which was for Medi-Cal funding. That was the initial intent for this tax. And so we aren't taxing, we aren't taxing the voters or the people. We aren't creating an additional tax somewhere. This already happens. All we are saying is that we want to put into law that these funds need to go back into Medi-Cal funding for Medi-Cal recipients.
What happens if this tax is not passed, or if Prop 35 does not pass and everything remains status quo?
A lot. We're in the same condition where we still need more primary care providers, where specialty care is inaccessible, and moreover, we have expanded Medi-Cal, right? We're continuing to enroll for folks into the Medi-Cal system, and it'll continue to grow because we've expanded access. Again, the right thing to do. But you need a system there, a group of physicians, a system that will hold the weight of those additional Medi-Cal recipients who are now entering the system. At AltaMed, we don't turn away anyone because of their ability to pay or other, right? And so, but in order for us to survive, we need to make sure that we can have those reimbursement rates that are fair and that will keep our system going, despite us getting now, in certain cases, double the patients in a lot of our regions where we are, we've exhausted our patient numbers. We've exhausted our doctors as well, right? We know that during the pandemic, 1 in every 5 physicians actually left the workforce because of it was too much. We're burning out our current doctors, right? I read somewhere that there was a huge peak in like suicide rates amongst physicians that I didn't even know. I actually went to this conference where they were sharing that. And so it's a domino effect, right? If we continue to have status quo, if we continue to burn out our doctors, if we continue to provide reimbursement rates that are subpar for the communities that need it the most, it continues this system of, to be quite frank, institutional racism. You are instituting it by way of the reimbursement rate lower for people that need it the most, right? And so there is no room for status quo, based on how things are going. But again, we are very hopeful that the voters in California will do the right thing.
Absolutely. And so what advice would you give to individuals looking to get involved in civic engagement and social justice advocacy in their own communities?
So the first and most important is to register and to vote, right? And also to make sure that not just every 10 years you're making yourself count in the census, because those formulas are to inform the funding, right, in your community, but that you're also participating in things like the American Community Survey, where communities of color are undersampled, yet that data is used for everything. So very, very important. And then you need to text all your family and all your friends in your phone book on your cell phone and remind them to vote as well, right? So you need to be an immediate organizer, a relational organizer in your immediate circle. And then after that, it's really looking at the organizations that you want to volunteer at that are aligned with your mission. They can always use volunteers. Canvassers are very hard to find, especially during election years, that are willing to knock on doors, that are willing to put in the hours. Funding is so limited for organizations that do civic engagement work, and it only comes every 2 years. And so in order to have sustained civic engagement, they heavily rely on volunteers. So please get involved with your local organizations. If you are aligned with a party or a candidate, do that as well, right? You need to be informed. You need to be part of the process that are making the decisions, and do not be afraid. The last, and I think the most important, is get involved with your city councils, get involved with your county supervisors, get involved with your state legislatures, participate in public comment. You don't like something, show up and comment about it. you disagree with the legislator, call them and tell them about it. And so we have to, again, be at the table when decisions are made for us and about us, because they have to include us.
Lizette, what changes would you like to see in policy or practice that would better support the healthcare needs of our Latino communities?
So I think one is making the civic engagement process more accessible, because when folks understand what is at stake and what is at risk, especially around healthcare, especially around women's health, I think there will be a bigger impetus to vote and to participate and to go to public comment, right? And so I think the system by which decisions are made needs to work better. More outreach needs to be done within communities, right, in order for us to participate. But then in terms of public policy, again, it has to include the public, and it has to first focus on the most vulnerable in our community to make sure that we are that these chronic conditions are not endemic, because we are not tackling them through funding, through legislation. And remember that budgets at all levels, city, county, state, are a reflection of the values of the leaders. And so leaders need to uphold their values and everything they ran on when the budget process comes along. And so that is really important, especially around healthcare. And of course, in healthcare, it's investing more in that healthcare workforce pipeline. It's not just talking about the fact that we need more Latinos and Spanish-speaking doctors, but it's being about needing that, right? Making sure that there's more slots in the UC system, making sure that there is a certain requirement for the UC system to release information on who the demographics of who they're accepting. There's actually a bill that passed, AB 2080, from Assemblymember Arambula, that would require that. And then it's making sure that we can meet the needs of the expansion of Medi-Cal, and that we can meet the needs in a way that still provides quality services, culturally competent services for the communities that need it the most, because there is no reason why our community has to get third class care because of the zip codes they live in or the income they have. And so that would be my dream, all those things, right? A small wish list, right, for Christmas. But all that takes reform. And so in order for us to reform the system, we have to disrupt the system. And I hope to continue to do that. And I'm so honored that AltaMed lets me do a little bit of that in the work that I do.
That's absolutely phenomenal. And you could see your passion and your heart and your dedication to the communities that you serve. It's coming through loudly. And I hope everybody listening hears this and can see it from this very important perspective, because there's no reason why any community should suffer, especially when there is dedicated funds put there for their care. And Prop 35 is going to be a very big deal. So Lizette, it's election day today. There's still time to get to the polls, cast your vote. What's your final message to those listening right now?
Vote. And remember, you have until 8 p.m. to cast your vote. If you are in line at 8 p.m., you still have the right to cast your vote. If you are not on the list, you have the right to ask for a provisional ballot. The most important part is to make sure to vote. And if for folks who say I'm in the state of California, it doesn't matter. There's not just the presidential race on the ballot. Vote down ballot. Vote for every single office and look at every measure. But please vote. Tell your family, your tias, your abuelitas, your neighbors, and your friends, because this is the most consequential election of our lifetime.
Absolutely. Thank you so much for being with us today, Lizette.
Thank you, Eva. I appreciate it.
Perfect. So for everybody listening, don't forget to find us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. Don't miss my interview with Dr. David Siegler, Behavioral Health Chairman of Arrowhead Regional Medical Center, who received his Doctor of Medicine degree from the David Geffen School of Medicine at the University of California, Los Angeles in 2011. He completed the UCLA San Fernando Valley Psychiatric Residency in 2015, where he also served as the Chief Resident of Inpatient Psychiatry. Dr. Siegler joined the ARMC team in 2019 as the Vice Chair of Psychiatry and soon became the Interim Chair for Psychiatry before accepting his current role in April of 2021. Next week, we will have Dr. Roger Duber. His sterling career spans nearly 40 years. He is a board certified and specializes in cardiovascular diseases. Dr. Duber was recently recognized by the American Osteopathic Association and San Antonio Regional Hospital as Physician of the Year. He has served on a range of educational and legislative committees, including the Ethics and Peer Review Committee, Chairman of Critical Care Committee, Chairman of Quality Assurance Committee, and is the current Chairman of Cardiology for San Antonio Regional Hospital. Dr. Duber has consistently expressed care for those in need, especially by conducting missions to Bolivia to administer pacemaker and rheumatic heart disease therapies. You do not want to miss it. We will see you all next week.
This has been the Southern California Business Report with Yvette Walker on KMET 1490 AM, FM 98.1, and ABC News Radio affiliate, a show dedicated to highlighting successful Southern California businesses and the people behind them. Remember to visit the podcast page on the KMET website.